Of the over 70 million people today that are on Medicare, 20 million of them, literally 30% of them, have chosen to go without part of Medicare coverage. Sometimes these plans cost $10 a month or even less. And by being on one, someone can save literally thousands and thousands of dollars every single year. Let me explain. Now, you're probably aware that Medicare has four parts to it. These are four aspects and coverages of Medicare. They are called Medicare A, B, C, and D. Medicare A is the inpatient side of Medicare for hospital and skilled nursing. B is the outpatient side of Medicare, as well as doctor services and durable medical equipment and home health care. The C of Medicare are replacement plans. They're called Advantage plans. Someone enrolls in a C plan, it's replacing original Medicare A and B for them. And then we have D plans. And that's the plans I want to talk about here, because D plans are optional. And so I think it's very important that people understand the importance of having a Part D plan. It can literally cost you thousands, and you'll see here in a minute, tens of thousands of dollars without a Part D plan. That's why I'm saying they're crucial. So first off, what do Part D plans cover? Well, they cover medications that are self-administered. These are the meds that you're taking home. These are the meds you pick up yourself at the pharmacy, or you have on a mail order basis. Your cholesterol meds, maybe your heart medications, high blood pressure, those kinds of meds that you're self-administering, those are covered by Part D plans. Now, it's important to note also, though, what Part D doesn't cover. There's things they do not cover, and that would be meds that are professionally administered. These are meds that would be in the hospital or an outpatient type of a basis, injections, infusions. You don't self-administer those. Those are administered by a doctor or by a doctor's assistant. Professionally administered meds are covered by either Medicare A and B, or they're covered by your C plan, your Advantage plan, all right? And so, again, D plans are separate. Now, thirdly, I want to talk about how do we get a Part D plan. Well, there's two ways we get them. Number one, if someone chooses to enroll in original Medicare A and B, almost always they get some kind of a supplemental plan to fill in the financial gaps, so they don't have to be out of pocket for those gaps. And then when we have this coverage, then we add what we call a standalone prescription drug plan. It is separate. It is a separate company sometimes. It's a separate policy, a separate premium, and that's why we refer to those as standalone plans. Now, another way we can get a Part D plan is if we go with one of these Advantage plans, C plans, we actually can include them. So we call that a Medicare Advantage PD prescription drug plan. So it's all in one. So the insurance company issues one card. It's what I use for inpatient, outpatient, as well as my self-administered prescriptions that I pick up at the pharmacy or get through the mail order. All right, then fourthly, I want to talk about how Part D plans work. Part D plans are probably one of the most confusing parts of Medicare. I'm explaining how that works. Now, they are getting better. They're going to improve in 24. They're going to improve even more in 2025. But I'm going to show you a slide here just to explain exactly how Part D plans work. Now, as we look at the structure of Part D plans, I want to make just a very quick and easy comparison. And that would be, I want to compare Part D plans to what you and I are accustomed to before we go on Medicare. These would be our group plans at work or individual plans. Group plans and individual plans have what we call one phase or one stage plans. And what that means is we're on a medication that's covered by the plan, and it is given a tiering number. It could be tier 1, 2, 3, 4, 5, but the tier number tells us what our copay is. Tier 1 may be a $5 copay, tier 3 may be $40 copay, and that copay that's established based upon the tier of the medication does not change all year long. So if I pick up the prescription in January or July or December, if I'm on a tier 1 with a $5 copay, all year long I pay $5 for that medication. If I'm on a tier 3 that costs $40, again, all year long I'm going to pay a $40 copay. So we have fixed copays on our group plans and individual plans. So that's why we're saying it's a one stage or a one phase plan. When we go on Medicare, whether that's a standalone Medicare drug plan or it's embedded within the Advantage, we're actually going to have four phases, four stages, and just simply means our copay is not fixed throughout the year. Our copays can actually fluctuate depending upon what phase we are in. So let me explain the phases. Phase 1 is called the deductible phase. Now, what this means over here is while I'm in this phase, out of pocket, what I'm going to do, I'm going to pay copays based upon one of two things, either the tier of the medication or the actual cost, whichever is less. And I stay in this phase until I reach my deductible. Okay, this year, 2023, that is $505. Next year, if you're watching this in 2024, preparing for 24, that is going to be $545 deductible. And it just simply means that I pay a copay, everything's applied to the deductible, and if I never reach that deductible, which many people will not, then you will stay in this stage all year long. Now, those people that take a lot of meds or maybe expensive medications, they most certainly are probably going to meet their deductible. So if I meet the deductible, that automatically then puts me down into the next stage. If I don't, I can stay here all year long, and that's frankly what happens to a lot of people. All right, so that's what moves us into stage 2, is once we have met our deductible. So let's talk about the stage 2, which is called initial coverage. And when I say it's called that, that's what Medicare officially calls it. So in this particular stage, what is happening, I again am paying copays based upon the tier of the medication. And folks, they are very reasonable copays. I mean, there could be a medication that retails for $500, $600 and you're paying a $45 copay after you've met your deductible. So again, very reasonable. But here's what's different in this stage. As I get prescriptions in this stage, yeah, I'm paying a copay based upon the tier, but what's happening is Medicare is actually tracking the retail cost. Now, I'm not paying retail, but they are tracking retail. So if I'm getting a medication that's $100, I may have a $10 copay, but Medicare tracks $100. I may be on a medication that retails for $600, and I may be paying $45 for that in copay, but Medicare again is tracking the retail cost. And so as this retail cost grows throughout the year, as I get prescriptions throughout the year, if I ever reach what is called the threshold, and this is again is the retail threshold, and please understand this, you haven't spent $4,660. In fact, you may have spent somewhere maybe around $1,200 at this point, give or take. But you haven't spent that for sure, but that's been the retail. It's been what you have paid, but also what that Part D plan paid for, total retail cost. And so if I ever reach this threshold, and again, that could be in 2 weeks, it could be in 2 months, it could be in 7 months, it could be never. In fact, they say that less than 10% of all people ever hit that number. Only 1 out of 10 will. But if I ever hit that retail threshold, then that's what's going to push me then down into the next phase, which is called the donut hole. And so now next year, as we get into 2024, I want to make sure you know this number is changing. It is going to $5,030. So again, the retail cost is $530 in 2024. Then that's going to push me into the next phase, which is phase 3, called the coverage gap, or this is the one we actually call the donut hole. Okay, the donut hole came about in 2006 when Part D plans were introduced, and they have realized that was kind of a mistake on the donut hole. So year by year, we've been improving that donut hole out-of-pocket expense. But while I am here in the coverage gap, the donut hole, what happens? I am going to pay a flat 25% of the actual retail cost of medication. So if I'm on a medication that costs $100, my out-of-pocket expense is $25. If it's $1,000, I pay $250. So it's 25%, whether that's brand name or a generic, is my cost. Now, again, we have, you'll notice, a different threshold. Medicare's tracking another number. Now, this particular number, just so you know, is actually called the TROOP. True out-of-pocket, true out-of-pocket. So what that means is, as I get prescriptions, what they're tracking to get to that number would be everything that I have spent thus far throughout the year, whether that's 3 months in, 9 months in, everything I have spent, plus in this particular stage, what's happening is the manufacturer of a brand name medication that I'm on, and by the way, that's what puts us in the donut hole. It's not generics typically, it's brand names. The manufacturer must give me a discount of 70%, and that 70% discount is going into that $7,400 number. So what I paid out of pocket plus 70% goes into that. So even when we look at that threshold, it's not what we're spending. Again, that's probably going to be, roughly $2,000, maybe $2,500 out of your pocket, certainly not the full amount. Now in 2024, they're changing that number as well. It's going to $8,000. All right. And so if we ever reach that $7,400 this year, $8,000 next year, then what happens is we're done. And again, we're going to go to the final stage, which is called, notice here, phase 4, called catastrophic. Now, I'm shooting this video September of 2023. Right now, in the catastrophic stage, your out-of-pocket expense would be 5% of the retail cost. And you would continue to pay that 5% for the remainder of the year. So that really is an unlimited amount. But here's the good news. In 2024, 2024, this right here is going to be eliminated because in 2024, we have a zero copay in the catastrophic stage, okay? And we're all excited, of course, about that as well. Okay, so that is the structure or exactly how Part D plans work, and that's what really makes them such a great value. Let me explain. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link, and you click on that link. What we're going to do is we're going to give you free access to this Medicare Essentials Workshop, and we want you to watch it because we don't want you to make any mistakes. And so when I began the video, I was explaining that really I think Part D plans are very necessary. But let me explain to you here where you say, why are Part D plans so necessary? Let me just add the word here for just a minute. Why are Part D plans not so necessary? Okay, I'm going to give you an example of some very common low-cost medications for different conditions. High blood pressure. A lot of people take losartan. They could be taking lisinopril, but usually very low-cost meds. Notice, if I don't have a drug plan, I could go on GoodRx or Mark Kuman's group, Cost Plus drug company. I could go there or some of these other different programs. I can actually pay cash, and I get that losartan for $9, maybe even a little bit less. So very, very inexpensive. Cholesterol medication. The most common people are taking right now is atorvastatin. It's generic Lipitor. Again, you'll see very low cost, $14 a month or less cash price. And then nerve pain, gabapentin, a lot of things people take for pain, but gabapentin is a very common one, and you can, again, get a cash price on that for $12 a month. So really, not much for these kind of medications. Now, you'll notice, now if I get a drug plan, I'm probably going to, because these are going to be tier 1s, probably going to get those at zero copay, and your gabapentin, probably a tier 2 non-preferred generic, going to cost you $5. And again, this is give or take. Plans are going to vary, but this is very general cost with a drug plan. But my point is this. I don't necessarily get a drug plan because I'm taking these kind of medications. It is true, they're very low cost anyways, okay? But I get a drug plan because I may end up needing a medication that is very expensive. So yes, I'm saying for these kind of meds, it's not so necessary. But again, I realize that something could happen to you in 2 months, 3 months, 6 months. You get diagnosed with cancer, diabetes, or some very serious health issue, and you're going to need some expensive meds. So I'm in agreement with you. I don't need them for these kind of meds, but I don't get them for these meds. I get them just in case I need an expensive med. And none of us have a crystal ball. We have no idea what the future holds for our health, but we have the opportunity to buy Part D plans when we first go on Medicare, and then on an annual basis we can renew those. And so that's what I'm saying. With these meds, not such a big deal, but there are some meds that are very expensive that you may need one day, and you'll be grateful if you have a drug plan. Let's go through that. All right, let's just begin talking about type 2 diabetes. Right now, there are, I think, roughly 30 million people that have diabetes. That would be a type 2 diabetes. The type 2 diabetes is very common today, especially among the senior population. And so this is someone that's insulin resistant. They have some blood sugar issues, and so they're taking medications to be able to control those blood sugar. So what the most common meds right now, as you can see, are Trulicity, Januvia, Jardiance, and then Ozempic. These are all brand name medications, very common for people with type 2 diabetes right now. So what I simply did is I went and did a search for if you were going to buy these on a cash basis, meaning you had no insurance whatsoever, and so you had to pay retail, but you were looking for discounts and coupons and all those kind of things. So you can see exactly what these meds are costing. Trulicity, almost $10,000. And again, these are annual costs for these medications. Januvia, a little cheaper. Jardiance, very comparable. Ozempic, a little over $11,000. So if I did not have a drug plan and I was diagnosed with type 2 diabetes and I needed these medications, that's exactly what's going to cost me for the year. But notice, if I have a drug plan, a Part D plan, again, Part D plans on average are about $30 a month. There are some that are less than $10 a month. There are some a little higher depending upon all the medications that you take. And so if I have a drug plan, again, I ran real numbers on all this, that Trulicity for the whole year, the most I'd spend is about $1,992. Look at the savings. almost $7,700 I saved by having a drug plan that literally I could buy for $10, $20, $30. All right? Geneva, again, a very, very common medication. You can see the savings. If I have a drug plan, I've saved about $5,800. Jardiance saved, again, about almost $6,000. And then notice on the Ozempic, very popular right now, savings almost $10,000. And so that's the point. I can save these kind of monies by just simply enrolling into a Part D plan where I have a very small premium. Because why? Because drug plans are structured so well now, and I get the benefit of going through those different phases, and eventually, of course, get to catastrophic, where my meds this year are 5%, next year would be 0 out of pocket. All right, so that's just type 2 diabetes. And by the way, diabetes is the 8th leading cause of death right now. It is, again, very common. I think 30% of all people that have diabetes would be the Medicare population. So very likely that some of you would have diabetes, and you certainly do not want to be diagnosed with diabetes needing a medication without a drug plan. All right, let's look at the second issue here, and this would be heart disease. Actually, heart disease is the #1 killer among Americans today. And this is going to be people that have blocked arteries, other issues, irregular heartbeats, those kinds of things. But it's due to heart disease. A lot of medications are prescribed, but these are some of your 2 most common meds right now that Medicare recipients are on. I've got lots of clients that are on these meds, Eliquis and Xarelto. Now, you'll notice Eliquis, if I had no drug plan, and again, I did a search, what's the cheapest I could get that Eliquis if I had no drug plan, therefore I'm paying for it out of pocket? Almost $7,000 for the year. Xarelto, pretty close to that. They're very comparable kind of, competitive meds. These are also for AFib type issues when people get diagnosed with that as well. And now notice though, if I get a drug plan, that Part D plan, whether it's embedded or it's a standalone drug plan, look at the cost of that. A little bit less than $1,000. So we're saving $6,000 almost every single year just by having. So what is that? We're saving about $500 a month, and I'm getting a plan for anywhere from $10 to maybe $30 a month to be able to save that kind of money. So again, you may get heart disease. I hope you don't, but if you did, if you got these meds, you'd be very grateful that you had a drug plan. And then lastly, let's talk about cancer. Now again, there's lots of different cancer meds, but this is one right now that is very, very common. And this would be self-administered chemotherapy pills. Now this is a crazy, crazy high medication, but what's interesting, Medicare will cover this whenever it's necessary. And so you do a retail search on this med, it's called Revlimid, over $330,000. And I'm not joking at all. If I get a drug plan, it will be covered by Medicare. It will be. And so this year, because remember I had that catastrophic phase, I get through phases 1, 2, and 3, deductible, initial coverage, and donut hole in one fill. And then the rest of the year, 11 months, I'm going to be in that 5% copay. So it's going to cost me about $19,478. Get this. Because we're eliminating the catastrophic stage in 2024, next year, this would read $4,000 is all that you would spend out of pocket. Okay, because catastrophic is done. This year it's 5%, and 2024 it'll be 0%. And then the beauty going into 2025, if you have a drug plan, the most anyone will spend will be $2,000 out of their pocket all year long for their medications. And there's legislation work right now saying how can we even take that $2,000 and spread that throughout the year. So again, that's the benefit of having a drug plan if indeed you needed these self-administered chemotherapy pills. Just one more. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. Now, this one is called Stara. Stara is very common use. I got lots of clients that are on this for these conditions and a couple more, but primarily for anyone that has serious psoriasis, or someone that has psoriatic arthritis, or someone that has Crohn's disease. They will be often prescribed Stara, right? Stara on a retail basis. If you had no drug plan whatsoever, if you could afford it, it would cost you $171,828 throughout the year. But if I have a Part D plan, again, we've talked about those, embedded or standalone, that's going to cost me $11,456. Why is that? Because I still have phase 4 this year. Catastrophic is 5%. But next year, going into this, that would cost me $3,500. Why? No 5% coinsurance in stage 4. All right. And then what's going to happen in 2025? The most it would cost me would be $2,000. So this year, someone had a drug plan, they could save almost $160,000. That improves in 2024 and even greater improvement in 2025. So I hope you understand the importance of having a Part D plan. Now, as I wrap this up, I do want to make sure you understand that as I talk about these plans, I am not promoting Part D plans because of any kind of a benefit to us. Honestly, we make very little money on drug plans. They'll pay us a little stipend, but not much. They take a lot of work, but they're important because medications today are very costly, as you've seen. And statistically, they say that we'll spend more money on medications than anything else today in healthcare. So that's why prescription drug plans are a big deal. And so I know some of you are not taking these kind of meds. You're taking cheap meds, and you know about GoodRx, you know about Kuban's, discount program and all that, but you have no idea what could be in the future. And so I'm suggesting and really encourage you just to find a drug plan, even a low-cost drug plan, because you get the benefit of all these phases and all these rules as the government has worked very hard to improve the Part D plans. So take the time to make sure that you have one, it's the right one, and the beauty is we also can change those every year. With no underwriting, if that drug plan is in your area, your zip code, you can have that particular plan, all right? And we'd be thrilled to help to make sure that you have the right drug plan.